From the Journal of Dr. Sangeeta Kambata, Medical Supervisor, St. Agnes Reformatory for Wayward Girls. The vital role of prostate milking in the care of involuntary chastity patients. As the primary caregiver, overseeing numerous men who are confined to chastity devices, many of whom are not in this situation willingly, I find it crucial to document the significant role of regular prostate milking in their care regimen. These patients, often subjected to circumstances beyond their control, face unique physical and psychological challenges that require careful attention and management. In my practice, the philosophy of St. Agnes permeates our approach to care, emphasizing strict adherence to rules that prevent intimate pleasure and sexual gratification. This philosophy is grounded in the belief that absolute control over one's desires can foster personal growth and discipline. For many of my patients, this control is not merely a choice. They are locked into their devices as a means of compliance with this philosophy, and they are supervised by governesses who are very swift to correct any attempts at forbidden action. The resulting emotional and psychological turmoil from involuntary chastity can be profound. Men who are compelled into this state often experience feelings of humiliation, frustration, and loss of autonomy. It is imperative to acknowledge these feelings while ensuring their physical health is maintained. In this context, prostate milking serves not only as a therapeutic measure, but also as a means of reinforcing the principles of St. Agnes, particularly the idea that pleasure can be managed and redirected. It is worth noting here that under the philosophy of St. Agnes, all of these men are considered to be women or sissies and treated accordingly. I agree with this philosophy and address them in the manner that is most appropriate. However, as a medical professional, I recognize that individuals with different body parts require specific treatment. So in the course of this journal, I shall be referring to the masculine pronoun. The prostate gland is integral to male reproductive health, producing seminal fluid that serves vital functions. In patients kept in chastity, the natural processes of ejaculation are disrupted, leading to an accumulation of prostatic fluid. This buildup can result in various complications. 1. Pelvic discomfort. Regular prostate milking prevents discomfort caused by fluid retention. The inability to release this fluid can lead to chronic pain in the pelvic area, which detracts from the quality of life. By integrating regular milking into their care, we mitigate these physical symptoms while adhering to the St. Agnes philosophy. 2. Prostatitis risk. Stagnation of prostatic fluid can significantly increase the risk of inflammation and infection, conditions collectively known as prostatitis. Symptoms can include severe pain, fever, and urinary difficulties, necessitating medical intervention that could otherwise be avoided through preventative measures. 3. Psychological relief. The emotional aspect of sexual health is paramount. The men I care for frequently experience heightened anxiety and distress due to their inability to release sexual tension. Regular prostate milking provides a form of relief that does not involve forbidden pleasure, aligning perfectly with the St. Agnes doctrine of total control over intimate desires. This balance helps them manage their feelings of frustration while still operating within the strict parameters set by their circumstances. To address these unique challenges, I have implemented a regular care protocol involving prostate milking sessions every 2 to 4 weeks, tailored to meet the individual needs of each patient. Each session is approached with professionalism and care, ensuring the dignity and comfort of the patient throughout the procedure. During these sessions, I take time to explain the physiological processes involved and emphasize the importance of prostate health. This not only informs the patient, but also helps them feel more engaged and less like a passive subject of care. Open communication is encouraged, allowing patients to express their feelings about the procedure, their chastity, and any discomfort they might experience. Prostate milking can often be a humiliating and humbling experience for these men, a factor that is not overlooked within the St. Agnes philosophy. This aspect serves to reinforce their submission and adherence to the rules governing their lives. Embracing the experience of vulnerability during these sessions can foster a sense of humility that aligns with the values taught at St. Agnes. The act of prostate milking requires the patient to relinquish control, a significant psychological shift for many. The process can evoke feelings of shame and embarrassment, but these feelings are recognized as part of the broader experience of submission and discipline that St. Agnes espouses. This duality, physical relief paired with emotional humility, creates an environment where patients can begin to accept their circumstances and learn to cope with the strictures imposed upon them. As I continue to oversee the care of these unique patients, my commitment to their holistic well-being remains steadfast. Regular prostate milking is not merely a clinical procedure. It is an essential element of their treatment plan that addresses their physiological health while reinforcing the psychological and emotional frameworks of St. Agnes. By carefully documenting these practices, I aim to create a comprehensive understanding of the importance of prostate health and emotional well-being for men living under involuntary chastity. This knowledge is not only vital for their current care, but can also inform future practices, ensuring a more compassionate and effective approach to managing the complexities of their unique situations. To that end, I shall now explain the process of a prostate milking using one of our less than cooperative subjects. What follows is the final report of a recent milking procedure. Objective. Subject is a 29-year-old male currently living under an enforced female persona with the vernacular title of Sissy maid applied to their status. The primary aim of this procedure was to alleviate persistent pelvic discomfort experienced by the patient and to encourage the release of prostatic fluid, which could provide relief and aid in further diagnostic analysis. This technique is particularly beneficial for individuals with chronic prostatitis or unexplained pelvic pain. Preparation. Prior to the procedure, the patient expressed significant hesitation and resistance. Although I provided thorough explanations about the benefits of the procedure, his anxiety remained elevated. It was necessary to employ light restraints to ensure his safety and prevent any sudden movements that could complicate the procedure. The patient was reassured throughout this process, with constant communication to ensure he understood the necessity of the restraints, which were applied loosely but securely to maintain control. The patient was placed in the lithotomy position, lying on his back with his legs elevated and spread to provide clear access to the perineal region and prostate. This has the dual outcomes of efficient access and reminding the subject of their low status in the St. Agnes environment. A generous amount of sterile lubricant was applied to my gloved finger to reduce friction and discomfort. Despite his initial objections, I encouraged the patient to focus on his breathing and relax as much as possible to reduce tension, particularly in the pelvic floor muscles. Procedure details. With the patient restrained, I began the procedure by gently inserting my index finger into his rectum, past the anal sphincter. As anticipated, he tensed up and verbally expressed discomfort. His body language indicated significant resistance, and I had to remind him repeatedly to focus on his breathing and allow the muscles to relax. Once past the sphincter, I moved deeper until I could palpate the prostate gland. The prostate itself felt moderately firm and slightly enlarged, typical for a man of his age, but without any alarming irregularities. Applying steady, firm pressure, I began to massage the lateral lobes of the prostate in a gentle, milking motion. The patient squirmed under the restraints, reacting to the unfamiliar sensation, but the resistance was managed with reassuring words and a calm approach. I made sure to use slow, rhythmic motions, working from the outer edges of the prostate inward, carefully milking the gland to stimulate the release of fluid. The patient's discomfort was noticeable, and he vocalized his unease several times, but there was no evidence of acute pain. After approximately 2 minutes of continuous stimulation, a small amount of clear prostatic fluid began to emerge from the tip. This confirmed that the milking technique had successfully produced the desired secretion. Observations? The patient showed signs of mental resistance throughout the procedure, though physical discomfort was moderate. The prostate was slightly enlarged, as expected, but there were no palpable nodules, lumps, or concerning irregularities. The prostatic fluid extracted was clear and normal in appearance, indicating no immediate signs of infection or inflammation. Post-procedure. After the procedure was completed, the patient remained restrained for a brief period to ensure he didn't make any sudden movements, while still adjusting to the physical sensations he experienced. Once he was fully calmed, the restraints were removed, and he was given time to relax. He reported a slight reduction in pelvic pain, though his emotional state remained unsettled due to his earlier resistance. Upon completion of the procedure, he was remanded to the custody of his hall governess. I prescribed 6 hours of rest, after which the subject will be placed back in maid uniform and return to their duties. Conclusion. Despite the initial resistance, the prostate milking was performed successfully, with no significant complications. The prostatic fluid appeared healthy, and further tests will determine whether any underlying conditions contributed to his chronic pelvic pain. The patient will be monitored for any recurring discomfort, and additional sessions may be recommended depending on his response. Signed, Dr. Sangeeta Khambata, MD,